Let me show you a little technique I like for a home exercise program for patients who have a difficult time lifting the arm in the air due to maybe a subacromial impingement or the rotator cuff's not acting like it should, and they might say this active range is painful, or even a wall walk might be painful. So what I like to do is try to address the force couple between the deltoid and the rotator cuff to try to avoid that excessive superior glide that the deltoid might be pulling the humeral head up under the acromion. So the little trick I like to have is I'll have the patient do an isometric, usually use a door frame. You can use the edge of a door as well. They can do an isometric into lateral rotation, kicking in their posterior cuff, and maintain that lateral rotation as they then work on that scapular elevation, right? Or they could use their medial rotators, subscap, which also helps depress the humeral head, and work on coming up that way. So a lot of patients will say that this hurts or this hurts, but when they do the isometric first to kind of see the humeral head, they're able to get their arm up without any pain. So let me show you what that looks like. I'll have a patient come over. So what you're gonna do is put the back of your hand on the wall here. So then I'll just direct the patient so that they're not really in the sagittal plane, but they're in more of a, between the scapular plane and the frontal plane. So just as tolerated, push the back of your hand into that door and keep that pressure and just slide up as far as you can. And they're usually pleasantly surprised that they can get full elevation as long as they maintain the lateral isometric, both on the concentric elevation and on the eccentric lowering, right? If that doesn't work, I can also try having them, we'll just use your opposite arm for ease. So step behind the door a little bit. Put your right hand or left hand on here, get rid of this one. Oh, and just hold the towel so it doesn't slide. Again, I'm gonna have you step behind the door a little bit to have her more in that scapular plane and not in the cardinal plane of flexion, right? So now what I'm gonna have you do is gently push into the door with an internal rotation isometric, right? And then just slide up as far as you can, pain-free. Right? So they can dust all their doors in their house as part of their home exercise program. So again, this should be pain-free on a patient. If it's not, I'll recreate a different exercise. But true open chain is often painful. So again, if you have them do an isometric, maintain the isometric with the cuff, either into lateral or into medial, it becomes much easier to get the arm up without pain. Thank you.